Hi, my name is Chris, and I'm here to talk to you about the proper way of sterilizing for a blood culture. Unfortunately, we've had many contaminations which come out to false positives on the blood culture. So we decided to change the procedure and add an extra few steps to help decrease on the contamination of these blood cultures. Okay, so we have our setup ready to go, and we're going to be going into the patient's room. Right before, I'm going to wash my hands and get ready for the process. Hello, Mr. Landers.
Hi, how are you?
My name is Chris. I'm going to start a blood culture on you, okay?
Sounds good.
We're going to test to see the bacteria that's in your blood and see what's going to be the best antibiotic that's going to be used, okay?
Alright, go for it.
Alright. So before we get started, I'm going to have to tell you that you're going to need to wear a mask, okay?
No problem.
This is to make sure that you don't breathe and get any contaminants on. I'll also be wearing a mask. This will help lower and decrease the contamination rate, okay?
Okay.
As you can see, we're going to get an IV setup kit. I'm going to set it up. I'm going to start mainly by opening up this sheet right here to try to keep things as least contaminated as possible. I'm going to get my gloves. As you can see, one of my gloves ripped. We can't have that. So we'll replace it and get a new pair. You want to always make sure to decrease as much contamination as possible. We'll also make sure not to hurt our backs and lift the bed to the proper position. We'll lower the side rail and get ready. Some of the things we'll need is a tourniquet, tape, a little gauze after, 2 chloropreps, our butterfly needle, and alcohol pads for the blood cultures. We'll begin by putting on the tourniquet and looking for the appropriate vein. Sir, I'm going to ask you to turn your head to the side and refrain from talking, okay? Also, if you had family members in the room, it's probably best to ask them to leave, okay? If they decide they want to stay, you can put on a mask. So we found the proper vein. We take off the tourniquet, do not leave it on. And then we come over here, and we're going to get some paper towel. With some soap and water. We now come to the site and we thoroughly scrub. We then get one of our chloropreps and we scrub for 30 seconds. Give it a little bit of time to dry. And we do it again one more time, but after we place the tourniquet on again. Once again, allow to dry. Make sure never to touch the site again, because if you do, you will contaminate the site. Sir, I'm going to do a pinch, okay, real quick. We insert the needle, and we draw the blood. And that's how you do the sterile technique for getting blood cultures.